The next speaker is Dr. Swati Kalki. She'll be speaking on artificial intelligence and machine learning in ocular oncology, retinoblastoma.
A very good morning. So I'll be talking about artificial intelligence and machine learning in retinoblastoma. I do not have any financial disclosures to make. Now, the use of artificial intelligence in medicine has become very popular in the past decade, and it is increasingly used in various fields like cardiology, radiology, etc. And it is mainly based on two parameters. One, the numerical data, where we use parameters like heart rate, respiratory rate, etc. Or image-based, where MRI or CT images or pathology images are used for developing AI model. In ophthalmology, it is very popular for conditions such as diabetic retinopathy and cataract, etc. Now, when we look at ocular oncology, not much is done in AI field, and so we wanted to explore for retinoblastoma. And if we look at our database, most of the malignant eye tumors that we see are retinoblastoma, and it is a tumor that affects children less than 3 years of age, and most of them present with very advanced disease, mainly because there is no routine fundus screening that is performed in newborns. Over the years, we have a large image database of the RETCAM images, which we capture in every child. And so we thought we will use these images to develop the AI model. The purpose of this study is to explore the utility of artificial intelligence and machine learning for diagnosis of retinoblastoma, and if diagnosed, to classify the intraocular retinoblastoma. The method that was used is these RETCAM images were first extracted. They were manually studied by two separate experts, and then these images were fed into the machine, and various algorithms were used to develop the AI model. Now, if such an image is shown, obviously it will be reported as normal. If a small tumor like this, it will be a group A tumor. If a larger tumor, a group B tumor. If it is a tumor with localized seeds, then it will be group C. If diffuse seeds, group D, and if it's an extensive tumor, group E tumor. Now, multi-label classification model was used for identification of optic disc and tumor, where it can identify the tumor or optic disc by a bounding box with confidence interval. Whenever optic disc was seen, the machine was taught that the optic disc size is 1.5 millimeters, so the tumor size was calculated accordingly. Whenever the optic disc was not seen, the machine was taught that the circle within which the image is there, it measures approximately 12 millimeters, and the size was calculated accordingly. Now, for identification of seeds, OpenCV algorithm with potential region of interest was identified. And once a region of interest was identified, deep learning model was used to identify the subretinal and the vitreous seeds. Now, AI model was trained to identify the optic disc, the tumor, the size of the tumor, the distance of the tumor from the optic disc, the distance of the seeds from the main tumor, etc. With this, the image analysis was performed on 771 images of 109 eyes, of which 78 eyes harbored retinoblastoma and 31 were normal. When two experts studied them, the inter-observer variability was less than 1% for individual images. For cumulative images, that is inter-observer variability was 0%. That means each eye would have more than one image, minimum being 4 images, maximum being 20 images per eye. For example, if this image is shown, it will be reported as normal. But if the different quadrant of the same eye is shown, it will be reported as group C because there is a tumor with localized seed. But if we go to further quadrant where we see diffuse seeds, it will be reported as group D. And there is another tumor in another quadrant where there is a large tumor with diffuse seeding. So ultimately, this cumulative reading will be a group D eye. The AI model, when it was used, the accuracy in detection of retinoblastoma was 95%, and classification as per group accuracy was 85%. However, there were missed diagnosis in 3% eyes, over classification in 9%, under classification in less than 1%, and misclassification of normal as RB in 2% eyes. If we look at the sensitivity and specificity, it was very good for detection of retinoblastoma. The specificity was good for grouping from group A to E. However, the sensitivity was variable from 63% to 100%. Conclusion is that AI model is a promising tool for diagnosis of retinoblastoma. It may be useful in classification of intraocular RB as well. The strengths of this study is that it's a first AI model for RB. It can serve as a useful screening tool, and it has very high sensitivity and specificity for differentiating normal versus a retinoblastoma eye. However, there are limitations that we developed this tool by feeding only the normal and retinoblastoma images. We did not feed other pathologies, so we cannot comment on whether it can identify other pathologies. The sensitivity was varying between 63 to 100%, and there was unequal distribution of images in each group. The future plan is to increase the sample size and use other machine learning models to improve the accuracy. The ultimate goal is that if anybody can take fundus images and send it to reading center, the AI model should be able to say whether there is retinoblastoma. For example, if this image comes, it should be reported as normal. But if such an image comes, it should detect that there is retinoblastoma and this patient needs to be referred immediately. Thank you very much.
Thank you, Swati. That is excellent work. Just one comment here that, as you mentioned, we often get cases of pseudoretinoblastoma, and that is where, it becomes even more challenging. So how do you see the future of AI when we deal with such cases?
Yeah, thanks, Bhavna, for the question. I think this is the first step. We definitely aim to expand it to other pathologies as well, but the AI model can definitely tell whether it is normal or not normal. That can be definitely known. The second step, of course, we want to put in different pathologies and see if it can differentiate different pathologies. At this point of time, at least it can differentiate what is normal and what is not normal, which I think is a starting step for any AI model.
Great, thank you. Anybody else?
Fascinating presentation, Dr. Swati. As we all know, screening in retinoblastoma has always been a topic of much conundrum. How do you, first would you like to comment upon the cost implications of applying AIML model at vision centers, because that is probably where we would find implication of this?
Correct. Yeah, I think this is, so first we wanted to have something, an AI model, where we know that once we have fundus images, we have something to assess it. So we are also working on developing a low-cost fundus camera where any vision technician who is not a doctor can also just non-mydriatic pupil, they can still take images. So that will be the next step, next future plan, where we will be using a low-cost camera, the images captured with a low-cost non-mydriatic camera, and then we will see if we can apply this AI model. But first we wanted to have a base so that we know that, okay, these images will be helpful. Right. So that's the reason that we started there, but we are also working back end for the other way for the other images as well.
We definitely hope that early diagnosis and early detection would be possible with implications of all of these technologies.